What is the prostate gland? What are its functions? What are the diseases of the prostate? Is a prostate problem always cancer? Hi, I'm Dr. Shashank Dhanuka. I'm a consultant urologist currently practicing in Kolkata. Well, in today's talk, we'll talk about what is the prostate gland, what are its functions, what are the disease conditions that affect the prostate gland, and what are the common treatment options for prostatic problems. So let's jump in directly. Well, what is the prostate gland? It's a gland found in men and is located below the urinary bladder. It is usually about 20 to 25 grams in size, maybe like a large walnut, and it is located at a place where the urethra passes through the prostate gland. So the passage of urine occurs through a pipeline that passes through the gland. As a man ages, the gland increases in size and it can give rise to various kinds of problems. What are the functions of the prostate gland? Well, the prostatic secretions contribute the fluid part of the semen. So semen consists of sperms, which are produced in the testicles, and the fluid part, which is majorly contributed by the prostatic secretions. So what are the disease conditions affecting the prostate gland? There are three common disease conditions that affect the prostate gland. Number one is prostatitis, which is basically an inflammation of the prostate gland. Number two is benign prostatic hyperplasia, or BPH. This is the enlargement of the prostate that occurs with aging and causes various kinds of urinary symptoms. Number three is prostate cancer. So each of these conditions is different from the other. We'll look into it one at a time. Prostatitis can occur at any age. It can occur in adolescence, it can occur in midlife, or even in elderly men. Prostatitis can be acute or chronic. It can be associated with a bacterial infection and sometimes even without. Prostatitis usually presents itself with a host of urinary symptoms, sometimes pain in the lower abdomen, pain in the perineum, and a discomfort while passing urine. Some people get a pain that is associated with their act of ejaculation as well. Prostatitis is usually treated with antibiotics and analgesics or painkillers. Sometimes chronic prostatitis may take a while to get treated. Usually, no surgical intervention is indicated for this condition. Coming to benign prostatic hyperplasia. This is a condition where the prostate gland has enlarged in size with aging, and because of its location, it causes a host of urinary symptoms. The common urinary symptoms associated with an enlargement of prostate are known as the lower urinary tract symptoms, or LUTS in short. These are commonly an increased frequency of urination, an increased nighttime urination, also known as nocturia, and urgency, where a person finds it difficult to postpone the act of urination when he gets the sensation of passing urine. There may be other symptoms like a poor flow of urine, where the stream of urine becomes narrower. Some people also get an intermittency, where the stream may start and stop multiple times during a single act of passing urine. People also feel that they have not emptied their bladder completely. This is known as a sense of incomplete emptying. All of these symptoms may or may not be directly proportional to the size of the prostate gland. The treatment is decided upon based on the degree of severity of the symptoms on one hand and the size of the prostate on the other hand. Treatments include lifestyle modifications, medications which can be used for a long period of time, and surgical treatment which is mostly endoscopic, minimally invasive. Usually the surgical treatments do not involve any incisions or cuts on your body. They are completely endoscopic. From the age-old TURP, which is the gold standard operation for prostatic enlargement, to the latest laser operations using a host of laser technologies like the holmium YAG laser, the thulium fiber laser, and so on. The results of the surgical treatments are excellent, and long-standing. Coming to the third condition affecting the prostate, that is prostate cancer. This is definitely the most sinister diagnosis associated with the prostate gland, probably the one that terrifies most men when they hear about a prostate problem. Prostate cancer, like any other cancer, is an uncontrolled growth of cells in the prostate gland. There are various factors that decide how lethal a prostate cancer can be. It includes the stage of the disease, the grade of the disease. The time when the diagnosis is made is very important. It is advised that all men above the age of 50 years should undergo an annual PSA test, which is basically a blood test to measure the levels of the prostate-specific antigen in your blood. This helps to screen patients for early detection of prostate cancer. Prostate cancer, if undetected, can grow and can spread to other parts of the body. Most commonly, it can affect the bones of the spine. This can present with pain in the lower back, and in advanced cases, it may even present with paralysis of the lower limbs. The diagnosis of prostate cancer, once established, with the details of the stage and grade of the disease, dictate the treatment of prostate cancer. Prostate cancer is treated with three major modalities of treatment. Number one is surgery, which involves a surgery called radical prostatectomy. This can be performed by an open approach, by a laparoscopic approach, or even by a robotic approach. The second modality of treatment is radiotherapy, which can be given in various ways, in various doses, depending on the stage and grade of the disease again. The third form of treatment is chemotherapy, which usually comprises of the conventional chemotherapy drugs on the one hand and the androgen deprivation therapy, which is a form of hormonal therapy that helps to control the growth of the prostate cancer cells. In a nutshell, prostate is an important part of every man's body, and one should be aware about the disease conditions associated with the prostate gland. For a healthy prostate, it's important to lead a healthy lifestyle. It's usually said that what's good for your heart is also good for your prostate. So take care of your prostate health, and in case you are suffering from any problems, visit a urologist, diagnose early, and treat early. Thank you for listening.